The FDA has reportedly opened a criminal investigation into the researcher behind one of the strangest medical stories you may hear in some time. It has to do with an experimental herpes vaccine, unconventional research methods, and a lesson in the things desperation can drive people to do. Our cover story is Short on Time.
This was a highly experimental vaccine that an American professor decided that he was ready to test on human beings. But he went ahead without any oversight in the United States.
Marissa Taylor is a senior correspondent at Kaiser Health News. She uncovered the unbelievable tale of Southern Illinois University professor William Halford. He invented what he hoped would be a miracle vaccine against herpes, a sexually transmitted virus that can cause lifelong, debilitating, painful outbreaks of ulcers on the genitals and face.
The participants who were involved were, many of them were very desperate for some kind of cure, and they went along with it, and now some of them are concerned that their health might have been harmed by this experiment.
There are strict rules in the U.S. dictating what scientists can and can't do when experimenting on people. The rules were forged after the government's syphilis experiment on black men in Tuskegee, Alabama in 1932. For 40 years, the government didn't tell the men they were in a study and didn't treat their syphilis even when they could have. An outcry in 1972 led to today's system, which subjects researchers to strict safety and ethics oversight.
Pre-labeled FedEx envelope you can mail back to us that contains all of the goodies in it. 2 capillary tubes.
The unorthodox way that Professor Halford went about testing his herpes vaccine violated nearly every U.S. law and regulation governing human experimentation.
As far as I can tell, the earliest he began experimenting with this vaccine on human beings was 2013.
According to some of the human test subjects here in the United States, he gave them these experimental injections at the Holiday Inn Express and a Crowne Plaza hotel near the university lab.
That is true.
Can you explain what might be in the mind of somebody who allegedly knows better, knows that there are rules, very specific rules to be followed in this country when it comes to human research?
It seems to me that he became convinced that he had a possible vaccine. But when he began to realize that he would have to actually go through the government, either the FDA, and also generally through a university oversight board, he became impatient.
Just blow on the tube like a straw to blow the blood out. And that's all we need, not much.
Halford led another round of experiments in 2016. He avoided U.S. safety rules by flying American test subjects to the West Indies.
What are the possible risks of somebody taking an experimental treatment without the proper oversight?
Some of the people who participated in this told me that they are not even sure that everyone had the type of herpes that he was trying to control and prevent. And there's one person who's concerned that he may have gotten a version of the virus as a result of this vaccination that he didn't have before.
3 patients are now suing Rational Vaccine, the company Halford co-founded.
What you want to do is go to a sink and run some warm water.
But it turns out there's a lot more to this incredible story. Not all of the human guinea pigs are complaining. Take Richard Mancuso. He suffered herpes outbreaks 2 to 3 weeks a month for 20 years.
It feels like you're sitting in a tub full of acid for a couple of weeks. It affects everything, and not just physically, you're thinking about it all the time.
And it affects your relationships because it's contagious.
Absolutely.
And partners of people who have herpes have to worry about them getting it as well.
Yeah.
Mancuso was recruited for Halford's study through a Facebook herpes support page.
Did he disclose to you the possible risks? Because some of the criticism is there wasn't an institutional review board overseeing this as is required, right, and certain other things that are supposed to protect human subjects.
It was a 3-hour interview, and he said, look, he goes, this is an experimental vaccine. It may help you, it may not. There's risks involved, and I'll give you the consent form. You can look at all the risks that could be possible. But I'm not going to sit here and try and convince you otherwise.
These are pictures from one of Mancuso's trips to the West Indies, where Halford flew him for injections. It turns out the reason Halford committed scientific misconduct wasn't for a dream of riches and living out a famous, wealthy life, but because he was on borrowed time.
He knew he was going to die soon.
We were hanging out one time, and he just said matter-of-factly, he goes, well, yeah, listen, I'm not going to be around much longer, so I need to, get the team up to speed. I'm going to die, so that's, it is what it is. But it's just, it was kind of hard to hear that.
Much of what we know comes from Halford's own writings, unearthed last June after his death from nasal cancer. He had believed in his vaccine so much, he'd injected himself and his family with it.
I can tell you exactly what motivated him. People would come up to him and say, please give me a reason to not kill myself. That's pretty intense.
After Halford's experimental shots, Mancuso says the illness that had plagued him for 2 decades seemed to go away.
Did he live long enough to know that you thought this was working for you?
Oh, yeah. Yeah, I told him all the time. Yeah, he knew.
I thought my life was over.
Shortly before his death, Halford, who had a doctorate in immunology and microbiology, told his story for an upcoming documentary, Patient Zero, the life and work of Dr. Bill Halford.
The number of people manufacturing biologics in the 60s was probably 10 to 100-fold greater than the number doing it today. And the reason why is because nobody could afford to get past this regulatory hurdle. And what they did is create $50 to $100 million of paperwork for anyone to even test a new biologic in a single patient.
Today, Halford's work is being advanced through his company and with help from his mentor, ophthalmology professor Daniel Carr at the University of Oklahoma.
It looked like what was happening with this vaccine was reprogramming the patient's immune response to be more protective against the virus.
Carr said he had no idea that Halford had been using unethical practices.
I think he thought of it more as, yes, I'm not following regulations to the letter of the law in any extreme, but I'm doing something that, in his mind, I think is going to benefit these patients. I mean, historically, there are individuals that have done extreme things to prove a point, and it turned out they were right. We have a lot of faith in what Bill's generated data-wise, experimentally. I'm utilizing one of his vaccines in our own model of ocular herpes, and it seems to work fantastic, better than anything that I've seen to date. So I'm cautiously optimistic that we're going to be able to really drive this forward.
There's sort of that tension between the risk and the benefit, and there's always going to be a risk. And I think the issue here is that he lost sight completely, at least according to the people who were involved, of the risk and the need for protecting the people who are actually being experimented on.
Not every researcher, perhaps, some motivated by other things, could be trusted to do things without the oversight of an independent institutional review board. If they say it's okay for one guy to do it just because it worked and because you liked him, is it really okay?
I would never say that the ends justify the means. But in this particular situation, I'm kind of glad that things played out the way that they played out, because I actually ended up getting help.
Southern Illinois University officials say Professor Halford misled them, that they knew nothing of his misconduct at the time, and are conducting a full investigation as well as cooperating with a federal probe.